Hi everyone, it's now 1 p.m. so we're going to get started with the Northeast Addiction Technology Transfers webinar series. Today we'll be discussing co-occurring disorders and mental disorders in adolescents. Co-occurring substance use disorders and mental disorders in adolescent population, which is a nice continuation of the previous webinar, last month's webinar, which was an overview of co-occurring disorders, and in particular, the TIP 42 training that was hosted by Paul Whitman. So those of you who have been following our webinar series, thank you for continuing with us. And those of you who are new, we will host some on-demand viewing of these series, so visit our website periodically to see if these are posted, and hopefully you'll continue on with us as we do our monthly webinar series that are topically based. Just a few items of housekeeping. Most of your correspondence you get through email from us, and many of you hopefully already did your pre-event surveys that were emailed out prior to this webinar with the webinar instructions. We just really need to have your feedback on the surveys. We absolutely look at them. I know my trainers do. So if you take the time to fill those out for us, we really appreciate that. And on that note, at the end of this webinar, you'll receive another email that will have the post-training survey on it. It literally only takes 2 minutes. I've done it and timed myself doing it so I could tell people authentically. It takes 2 minutes to get your feedback. And it's very important to us, and we do tailor our trainings based on the feedback that we get from you all. Additionally, you always get the PowerPoint presentations in that email and any of the handouts that the trainers utilize during the webinar session. Finally, I just wanted to introduce our speaker for today. Her name is Dorothy Farr. She is a trainer that has been with the Northeast ATTC for many, many years. She's actually here in Pennsylvania where we're broadcasting from, and has worked for years with national experts on the topic of co-occurring disorders broadly and in specific with the adolescent population. She was one of the authors for the revised addition to this 2010 revised curriculum manual, and just one of our most stellar and reliable trainers. So I'm very excited to introduce Dottie Farr.
Thank you, Ollie, and welcome everybody, and thank you for allowing me to join you today. The process is a little bit different than what I'm used to, as I'm not on site with the ATTC, and actually I'm not even logged into a computer to control these slides. So with Holly's assistance, we're going to move through this curriculum, and just be patient with us if we encounter any glitches. So if Holly, you can move us to the webinar agenda slide. Our agenda today will be to look at this adolescent co-occurring disorder curriculum, and we're going to review most of the content as best we can in the time we have allotted to us. If you feel like the full training would be useful to you or to members of your staff, you can find a listing of Department of Health and Department of Public Welfare certified trainers on the state COD webpage at www.pa-co-occurring.org. Again, that's www.pa-co-occurring.org. Trainers in your region can be contacted directly if you're interested in scheduling a training event of your own. So we'll go through the curriculum, we'll review some of the content excerpts from the curriculum, and we will use a case study to illustrate some of the content and certainly allow time for plenty of questions and hopefully answers. Actually, Holly, the next slide is just a title page, so if you can zip through that and go to slide 4 on curriculum development. This curriculum was first developed back in 2004 by the Division of Behavioral Health Care Education, Department of Psychiatry at Drexel University College of Medicine, certainly through support from the ATTC. The primary author was Taylor Anderson, with assistance from Dr. Donna McNellis, and Dr. Riggs was the senior advisor of this curriculum. She's an associate professor in psychiatry at the University of Colorado. The curriculum was reformatted once in 2006 And again, as Holly mentioned, in 2010, the manual was updated by Catherine Chichester and myself. Katie is the executive director of the co-occurring collaborative Serving Maine, which some of you may have read about in TIP 42. Katie and I have been working together and training since 1992, I think, when CCSME was first funded by a Robert Wood Johnson grant. The next slide identifies the 8 different modules that are in this curriculum. We are going to focus on 4 of these today. While integrated treatment approaches have been discussed in the literature for at least 20 years, and research that supports these models now provides us with evidence-based practice guidelines for the treatment of adults, but the research base for integrating treatment specifically targeted to the needs of adolescents is really just developing. This curriculum is designed to assist those who provide training to counselors working with adolescents who are in substance abuse treatment programs by highlighting the unique challenges they may need to consider when they're integrating assessment and treatment approaches to more fully meet the needs of adolescents with co-occurring disorders and their families. Obviously, we are not going to be able to complete this full 2-day curriculum in the 2 hours we have allotted today, but I'm going to try to cover some of the highlights with you. Next slide. So the way this manual is organized, it starts with a training guide that can be copied and used to help people implement each training session. The course works best if it's presented on 2 consecutive days. It has a very full 2-day agenda and a lot of material to cover, really in a very limited amount of time. To try and best meet the needs of adult learners, because I know it's hard for professionals to sit in a classroom environment all day, 2 days back to back. We really tried hard to actively engage people in the process by interspersing a lot of small group work and individual exercises, role-playing, films. We wanted to really engage people in the learning process. Each one of the modules comes with a specific goal for the module, the objectives that we hope to have achieved, and content materials and PowerPoint slides. It also gives the participants a huge number of backup materials and a bibliography. It's a very, very extensive study guide of all the information that went into the development of the curriculum itself. The overall curriculum objectives are to create, stimulate, and facilitate a cross-system and stakeholder dialogue regarding adolescent co-occurring disorders. We wanted to look at the current evidence-based treatment for co-occurring disorders and some of the promising alternative therapeutic strategies. We also list the core program elements that a program would need in order to provide effective integrated treatment interventions for adolescents. Next slide reviews the continued objectives of the curriculum. We wanted to help folks really look at the uniqueness of the adolescent developmental process and differentiate treatment from that of adults. This is really a key focus of the curriculum, looking at adolescent developmental process and sensitizing the counselors there to the fact that these kids aren't just short adults, that we sometimes have expectations of adolescents who are placed in adult treatment programs that they're not biologically or emotionally capable of achieving. If we don't understand their developmental issues and we aren't aware of the changes that are occurring in the brain, then we just might be setting these kids up for another treatment failure. We also hope that this curriculum helps participants to really look at the interrelationship between the mental health condition and the substance use disorder. We have to begin to understand why this individual is using substances and what they do for him if we're going to find a way to replace that need. After all, recovery is not just taking the substance away, but helping somebody learn the skills they need to live a productive life in their community. So during the 2 days, our participants walk through a variety of integrated, collaborative treatment approaches for people with co-occurring disorders. We look at some of the barriers to change, but we try to focus on the solutions that we can employ to implement and affect that change in our system. Next slide is Module 1. And our first module really provides us just with a brief overview of co-occurring disorders. And a big part of the module really is to create an active environment and atmosphere for learning. The goal of this module is to provide the participants with information to support a growing understanding about the nature of co-occurring disorders. Our objectives, next slide, discuss the association between substance abuse and psychiatric illness, and we look at some of the general statistics and trends among the adolescent population. The early association of the relationship between substance abuse and mental health disorders goes back, probably to the 1970s, when practitioners first became aware that the mental health conditions had an impact on somebody's substance abuse recovery outcomes and vice versa. Early studies tended to focus on depression, but it didn't take us long once we were training folks for people in both communities, substance abuse and mental health communities, to recognize a wide range of disorders were associated with substance abuse, not just depression. Researchers also recognized the dramatic impact that substance abuse may have on the course of treatment for mental illness. So fortunately, research over time has shown us that by providing substance abuse treatment for people with mental health disorders, it can be very, very beneficial, even if those people have serious and persistent major mental illnesses. Substance abuse treatment can be very effective. So just one example of that was a study done by the National Treatment Improvement Evaluation Study that found a very marked reduction in suicidality the year following substance abuse treatment compared to the year prior to treatment for adults, young adults, and adolescents who had a serious mental illness and a substance use disorder. So continuing with the evolution of co-occurring disorders, one of the things that I noticed, because I became involved very actively with examining these co-occurring disorder issues back in the 1980s, that the terminology began to change. When I first started working with folks with major mental illnesses, we called it dual diagnosis. Some of you might have used other terms, depending on what area you're from. You might be familiar with the term MESA, which stood for mentally ill substance abuser. MICA, mentally ill chemical abusers. There were CAMIs, chemically addicted, mentally ill. We had SAMI, which was substance abusing, mentally ill. But ultimately, we came around to a realization that none of those terms really accurately reflected what we were seeing in our clients, that many folks had more than one substance use disorder. They were addicted to alcohol and opiates, but they were abusing marijuana and cocaine, and in addition to their addiction issues, there were one or more mental health disorders present also. There were many, many complicating physical health conditions like diabetes and obesity and smoking and So there was really nothing dual about it, and we began to change our language. So we now use the term co-occurring disorder as a more accurate reflection. I suppose it's probably also important to mention here that co-occurring disorders aren't the same in everybody, and they can take many different forms. We can have somebody who has a psychiatric disorder that's developed.
And individuals will reach their full potential. We appreciate your patience.
Holly, can you hear me?